It is now my pleasure to announce the third speaker. To be honest, I think that any organizer would be perfectly happy to find a replacement of this caliber, to be honest. When you look at his CV, you will know why. The next speaker is Bernard Hédon. He qualified at Montpellier University Medical School a long time ago. He trained at Hammersmith Hospital, London.
But I freezed eggs.
And he was appointed as Professor of Obstetrics and Gynecology at Montpellier University Medical School and the Academic Hospital in 1985. Now, I'm not going to name them all, but it's clear that he undertook many local, national, and international responsibilities, among which he was, for instance, the president of IFFS, and he is also currently the president of the French College of Obs and Gynae. So it is a pleasure to announce you.
Thank you very much, Guido, and thank you very much to the organizers for this very interesting symposium. Well, my topic is social egg freezing in France. Why not? No question mark, because it is not, and my objective is to try to explain why. Is France a different country compared to the other European countries or compared to the US? In many ways, it can be different. But when fertility is at stake, it is exactly the same situation. The mean age of women at delivery keeps growing and growing at every statistics. And this is a very similar curve to the one which was presented by Jill about the UK. And France is not different at all in this regard. And we have more and more women reaching the age of 35, 39, 40, and panicking about their fertility future. And France is exactly in the middle of all European countries here. In the middle about the fertility, but also in the middle about the age at the age of giving birth. And France is also exactly in the same situation about the fertility of women. These women are not different. And whether dealing with natural fertility or dealing with assisted procreation fertility, it is exactly the same curve and the same figure as the one presented by Jill. So why is France so different? Because France does not allow social freezing comparison with what's going on in the UK, in Belgium, here in Spain, and in neighboring countries. And my task is to try and explain why. First reason, it's because it is the law. And the law imposes itself. And this is a very long story, which I give you very short, because it goes back to 1994, at the time of the first bioethical law, when assisted procreation was really starting on a wide scale and had to be regulated. And at that period, well, the lawyers gave as a definition for assisted procreation all medical and biological techniques which allow procreation outside the natural process. And they even cited artificial insemination, IVF, and all similar techniques. And the objective of these techniques are to fulfill the parental project of a couple, man and woman. And the only endpoint can be to overpass a medically diagnosed infertility or to avoid the risk of a severe and non-curable disease in the child. Of course, this was for pre-implantation genetic diagnosis. So, as you can see, from the very start, it was very precise, and it took assisted procreation into the medical situations only. And after that, we had two revisions of the law. In 2004, and this revision was about several issues, but one of them, Title VI, was about procreation and embryology. And in this chapter, it was dealt with fertility preservation. But again, talking with about preservation was only in medical situations, following what was already written in the first law, 1994. So fertility preservation was to be processed only in case of disease or in case of sterilizing treatments, and of course the cancer patients were the main objective of this decision. And a second decision was taken about during this 2004 law was about the impairment of vitrification. Vitrification was seen as an experimental technique and was not allowed to be used in humans before thorough control in the animal. So there was a sort of moratorium of several years imposed on vitrification. And this was about embryo cryopreservation and not about oocyte cryopreservation, because at that time oocyte cryopreservation was not developed on a wide scale, didn't work very well as it was shown. It was the slow cryopreservation process with very low results, and nobody was thinking about the scale it was going to take with the only 10 years after. So vitrification was impaired, was not allowed, and of course it had wide consequences, not only on the embryo survival, but also on the way fertility preservation and eventual egg social freezing could be developed. Because we had to wait until 2011, so that's 7 years before vitrification was allowed during the third revision of the law about, and here in Title 6, Chapter 6, about assisted procreation, it was again reassessed, that reaffirmed that assisted procreation was only with medical objectives. So no assisted procreation was accepted for personal reasons, and no assisted procreation for homosexual couples. And the homosexual couples were the main objective of this reaffirmation of keeping assisted procreation only in medical situations. And it was not very much thought about social egg freezing, at least at that time in 2011, because vitrification having been impaired in 2004, there was no experience in France about the results that vitrification was able to give in freezing embryos and oocytes. And of course, the lawyer, followed the situation in the country, and as there was no experience, they were thinking only about homosexual couples, and this is why they reaffirmed that assisted procreation had to be kept with medical objectives only. But there was just one small opening. It was about gamete donation. Because France is in lack of gamete donation, not only in women, but also in men, in both genders. And in order to try and increase the number of gamete donations, it was offered to open gamete donation to childless men and women. And because of psychological reasons, if they, after that, do not have a child personally because of infertility, they would be allowed, at the same time as gamete donation, to keep a number of gametes for themselves, either spermatozoa or oocyte, which was, of course, an opening for social egg freezing. And 2011 was the green light for vitrification, as I said. So the first reason is the law, and the law has not changed since 2011. I will explain why. Reason two. Reason two, it's because the healthcare system in France. The healthcare system in France is based on gratuity, general gratuity. Nobody pays for anything when health is at stake, and global equality between everybody. You must have the same access to medical care if you have a very low income or if you are a very rich person. This is the principle in France, and it is very much in the minds. When dealing with social egg freezing or social spermatozoa freezing, something which is considered as no medical reason, but a real social reason, there is a thorough discussion about should it be paid for by the social security. And of course, we can understand that there is a limit in the amount of money a country is able to put into medical care, and opening the gratuity not only to all medical care, but also to social situations is opening a big box. And of course, as you know, there is no more money, and especially in France, and nobody wants to even think about it. So the second reason is very serious because it is also in the minds. And there is a third reason. Because if social egg freezing is allowed, it could also imply to open these services to homosexual couples. And as you could see, in the process of the different laws in 2004, it was firmly reaffirmed that France is not prepared to open assisted procreation techniques to homosexual couples. And I want to explain why there is this link between social egg freezing and homosexual couples. Because there is a man, which you recognize, who got elected as President of the French Republic on the basis of a program which implied, of course, huge success on the unemployment situation, and also various openings in social situation, especially about the marriage of homosexual couples. And this is very funny because this man has had 3 wives. And he married none of them. He never got married. But still, he had the program which was called Marriage for All. And having no success on the unemployment side, he tried to have success at least on the social side. And he put together a law opening the marriage for all. But as he got very unpopular in France, this law on marriage for all, which is equality and normally should be easily accepted, was not accepted very easily at all. And there was huge demonstrations in the streets, which were called demonstrations for all, against this marriage for all. And one of the reasons of these demonstrations was, of course, the unpopularity of the president, but also because behind the marriage of all, there was a fear that it would also mean assisted procreation for all. And these demonstrations have become very powerful. The law got passed, so marriage for all is passed, and I think this is a very good law. But as it was very difficult to pass this law, I mean, assisted procreation for all is not ready to get on the floor again very soon, especially because the present situation is politically very unstable. And the majority is very narrow indeed, because there is a huge failure on the unemployment side, and the majority is losing deputies, at every election, and because there is a huge resistance against, what is called family destruction, about these social laws that the president would have liked to pass. Well, happily enough, on the scientific side, that is on the side of the OBGYN, obstetrician and gynecologist, and I am talking in the name of the French College, seeing that vitrification has brought so much advantage in the future fertility of embryos and ovocytes, and of course on the scientific side and medical side, I mean, we can compare with what's going on in the UK or in the US or here in Spain or anywhere else in the world. We as doctors, we are very much prepared to open this service to women, and especially the French College of OBGYN, which has one motto, which is the health of the women. And having had a huge reflection on this, I mean, we have concluded that it would be positive for the health of women in our country to open social egg freezing, because the trend is so huge in the late age at maternity, and because of all what we know about the possibilities of assisted procreation with low results when age is coming in the woman. And because we also know the difficulties for these women to get egg donation, and for many other reasons as well, we as doctors, we are very much in favor of having the possibility to do social egg freezing in our country. So we have put together a sort of resume, a sort of communique, which you have here, in favor of this. And we have gone further, and it has been a lot of discussion within the college about it, about what would be the proper age at freezing. And as you have already said, and we are not different in this regard, it would be optimal before 35. It would remain possible up to 39, depending on ovarian reserve, of course. And women must be informed that chances to get pregnant with ovocytes cryopreserved after the age of 39 decrease notably the chances. And before 30, we will not be prepared to do any cryopreservation unless there will be a medical condition threatening fertility. This is what we have written, we as French college. And we also have had a thorough discussion about the age at embryo transfer. And I must say that it was easy to pass the first motion on age at freezing. It was more difficult to pass the motion about the age at embryo transfer, because obstetricians in our college are very concerned with complications occurring with the increasing age at pregnancy. And our common denominator has been to accept that it would be optimal to do a transfer before the age of 45. Between 45 and 50, it will depend on the clinical situation of the woman, depending on added potential risk factors, and that women must be informed in any case of this increased risk. And we would fix 50 as being the limit that we have to tell the patient. So this is what doctors in our country think about egg freezing. But my conclusion is now, and I hope you have understood the situation, that France is not a different country. Situation is the same, but we just have a problem. And this problem can let me conclude that we need social freezing. But because the next presidential election is only in 2 years' time, and it's not in the front row of the issues to be discussed presently because of what happened in these latter years, I think that it will be long before it can be accepted. Preservation of fertility is increasing very much, but it's always for medical reasons, and it will expand very much. And in my view, the social egg freezing will come progressively by extension of these indications on medical situation, because age of the woman is very often in connection also with other issues which can be, you can, for example, find an ovarian reserve which is decreased at the age of 35, and in this case you can say that this is a medical situation. Well, you can expand the medical indication. But still, in the meanwhile, I mean, we will keep referring our patients because we think this is good for the health of the women. Thank you very much.
Thank you. I'm not 100% sure whether we now understood why France is the same as the others, but are there any questions in this regard? Dr. Borini?
Thank you for your lecture. I have understood well that the College of the Obstetrician just suggested to forbid egg freezing before the age of 30. Is there a reason?
Well, the idea is that the sooner you cryopreserve eggs, the more women you will do that for no reason. They won't seek to use their eggs because they will find the prince, you know, at the usual age, and we'll have a normal pregnancy at the usual age. So in order to decrease the percentage of patients doing egg freezing for nothing, I mean, this is
the social egg freezing. It's like only like that. We need to have between 25 and 30, I think. After that, probably they will have an IVF.
Well, there is discussion, I agree. I mean, we have no experience. It's only to fix limits. And as doctors, as college, we have put a sort of stone in the garden of the politicians. We had to say there are limits. Not all the women are going to undergo egg freezing, so don't panic. I mean, it's only for a small percentage of women we have to have an opening. So that's the reason, the main reason why this lower age of 30 was given.
Thank you, Dr. Hédon. I see that the French College is in favor to social freezing, but as equality is important in the French culture, do you think that should be paid by the public health system or paid by the own patient?
Yes, well, this is an important question in our country, and of course, as we know that there is no money, I mean, we couldn't say that it should be paid for everybody. So this is why we just gave a message which was a medical message. We, as doctors, think that it will be good for the health of the patients, of the women patients. This is our message. My personal thinking about this would be that we must get outside of this global equality. It can't be living very long. I mean, already there are discrepancies. I mean, if you look into details, not everybody is equal in our country. We are not different from the others in this regard. Inequality is everywhere. This doesn't mean that we must abandon our social security system. No, we think that it is a very good system, it's very human, but still it has limits. And this is one of the limits. I personally think that it should be the personal patients to pay for this service, which is a personal service, as you are buying other things. I mean, you buy your fertility extension.
Can I pick up on that one? Me, here. Just to try to find out what the reasoning is. If it was ever shown, we've seen the different scenarios regarding the effect that social freezing could have on the success rate at the end. Do you think France would change its mind if it were shown that, in fact, by freezing eggs, you would lower the cost in terms of IVF?
Yes, but you know, the politicians don't believe us because they have so much experience, you know, from doctors saying, look, if we do this and this, you are going to decrease, you know, the amount of money to put into the social system. And as you know, it's in fact always increasing. So they don't believe us anymore when we speak about economics. So we are more on the moral side that we say as doctors, as gynecologists, that women must be the equal of men. And in the reality, men can cryopreserve their spermatozoa in some social situations which actually everybody accepts. For example, if a man seeks sterilization, well, we do freeze eggs before he's sterilized. Why should we do that? It's not a medical situation, it is a social situation. He's asking for sterilization and we cryopreserve spermatozoa. And we can't do this in women. So there is a sort of unfairness between men and women, and we are more advocating on this side of we want equality between men and women. It's good for the health of the women, and we are not arguing so much on the economic side because, as I say, I mean, we are not very much believed on this side.
Thank you. Any further questions? Okay.
Yeah. So I have one question. First of all, thank you very much for your excellent lecture. And if I heard well, in France, in case of egg donation, social freezing would be or is permitted. What do you think about this option to permit it only if a woman also give her eggs for donation?
Well, I think we can't accept it as such. I mean, because that means it's sort of chantage, which in the translation of the word French word chantage, which
blackmail. Blackmail.
No, okay. Which, of course, is not exactly what you know, the French spirit about equality between everybody really wants. We don't want to, and this is a very basic principle there is no allowance at all, and we are not ready to have any opening in this side about buying for eggs, paying for eggs or paying for spermatozoa. When someone donates, it's of course for free. It can't be paid for. So if you pay your eggs by a sort of service which is not allowed to others, I mean, this is against the basic principle. And actually, I mean, it's so much contradictory with the usual way of thinking in this regard in France that despite the law was passed in 2011, there is no authorization yet to imply the law. That means that there are problems, and I'm sure that a sort of higher council would break the law because it will be against one of the basic principles of gratuity of the donation.
Last question then.
Thank you for the presentation. I want to add a contribution about the limit fixed by the French College at the 35. I think that there was a cost effectiveness review by Laura Renzi, which showed that the earlier preservation is performed, the worse the cost effectiveness is because of chances of it's just, I think, a matter of cost effectiveness. That's the contribution to that limit. Because if my daughter is 20, she asked me for social freezing. I said that it was not reasonable.
Wait a little more. I mean, the prince is coming.
And the second point is, I think that as the law will be so rigid in France, extension of medical indication will be, I think, the issue concerning some pathology like fibroids to be operated at 35 or 36. So I'm personally performing vitrification of oocytes before surgery and warming for IVF.
You're against the law, but we are here in Spain, so no microphone, no problem.
Thank you. I'm going to close this session. I thank the speakers all for their contribution. And so